We're seeing in the data is that virtual care really has defined discrete applications. As you mentioned, behavioral health is one of them, notably low acuity behavioral health. So, given that we do have a mismatch of supply and demand in the behavioral health space, there really is a huge opportunity for providers to think about how can we leverage virtual care to reach more Americans who need behavioral health services and really kind of build that relationship. I think there are things that are still being understood in terms of having an established relationship versus more of a transactional relationship, right? So, one of the things that works particularly well with behavioral health is if you're seeing the same provider virtually is different than going to a direct to consumer type virtual care thing where maybe it's a little bit more transactional, you're seeing someone different, or it's more around medication management. So, I think it's important when we think about virtual care to really delineate maybe kind of care delivery aspects versus maybe medication management. And there is probably more focus on the care delivery relationship piece that providers should really be thinking about. When it comes to medication management, the opportunity is to have some type of feedback loop so that there is integration on the medical side to see, okay, are we following up with this individual? And one of the reason that is probably under the radar or something that we don't talk enough about is we saw during the peak of the pandemic, and even it's kind of still happening now, that because virtual care has made things more accessible to consumers and patients, that it's easy for them to, we saw this with kind of Adderall and maybe, but with certain medications, where as people feel like they can go directly and bypass kind of a traditional provider, whether that's screening or get an official diagnosis of some condition, there isn't that connectivity with the medical system. And so what's to say that that person should be taking those medications, or is someone actually checking with them after some period of time? So I think it's just something to keep an eye on in terms of the connection between the two and the relationship with the patient. The next opportunity, probably would be to the extent that the provider, and this is just a, longstanding issue, as we both know, with the health economy around the integration of behavioral health and physical health, is to the extent that behavioral health providers can, assess there may be other comorbidity kind of issues that are related to that patient that maybe they are or are not seeking care for. That may be an opportunity to create kind of referral relationships and into more kind of higher acuity needs for that given patient. But that's always a little bit of that's not specific to virtual care necessarily, but it could be an opportunity to think more about as that is a good modality, of having good patient engagement.